Hi friends, in my previous video I had asked you to answer 7 questions before doing your FUE hair transplant. So let's answer each one of them. Is your donor area adequate? Now do you know that when you do an FUE, you need a thick donor area, and any thinness in the donor area can lead to visible scarring. In fact, there are many patients who are not even told that FUE leaves visible scars. Second, if you have any thin or curly hair, the amount of percentage wastage after an FUE is much more, can reach 20 to 30%, and in these situations an FUT is far better. Is your surgeon experienced, or is the team working with hired technicians? Sad but true, a very large number of clinics in Delhi and internationally are working with technicians who are hired, and these are teams who are running from clinic to clinic, and they do the FUE process and then go to another clinic. So do you want to do your hair transplant with such people? Is a plastic surgeon a part of your surgical team? See, it is essential to get the best result. You must choose a plastic surgeon who is part of the team which is going to be doing your hair transplant. Otherwise, at least do a background search on the doctors who are involved with your hair transplant. The most important question is actually the 5th question, which is, have you been told that you should be doing a mega session with FUE? Now, please understand, anything more than 2500 grafts is a mega session, and if you do extraction more than 2500 grafts in one session, you risk really ruining your donor area. The entire donor area will look like a sieve. You will see visible scars and a visible lowering in density. In addition, it is possible that your doctor might have to go beyond the permanent zone, outside the permanent zone, and that means the longevity of hair is less. You might lose 30 to 40% of your hair over time. Now, are you sure that your team is going to be doing hair processing? Now, we've seen that even in FUE, you need to process the hair in order to remove the extra skin on top of the hair graft. And we see so many cases of FUE done in so many clinics with puckering up, with an appearance which is like sunken in. It looks like small mountains. It looks very ugly, and it is because the grafts have not been processed. Lastly, have you been told the follicle count? Now, most clinics will give you an approximation of the graft count, but it is essential that you also get what is the follicle count, and we count each graft and we will give you an exact number of follicles. So these are very important questions that you must get an answer to before doing your hair transplant. I'm Dr. Amit, I'm a plastic surgeon. We're operating out of Delhi. I'm the director and founder of Divine Cosmetic Surgery.